Good morning everyone, I am Dr. Daniel Finney. I am from Andhra Pradesh. So I am working as a district epidemiologist medical officer in our district. We will start with few questions. Who is the father of medicine? Who is the father of medicine? Sir told to take a 1 hour class, but I don't know it, sir. 20 to 30 minutes because all are youth, no? I am also a young person, no? So we all don't like to have a long conversation. We like short and sweet. That's why everyone bear with me. So we'll have a very good interesting session. So just I want to give an orientation about public health and also modern medicine. Okay? Yeah. Who is the father of medicine?
Hippocrates.
Yeah. Hippocrates. So who is the father of community medicine? Who is the father of community medicine? John Snow. Can you tell me who is the father of public health? Just think. This is very important. When you write the entrance exams, no, these are very important. See, medicine. Who is the father of medicine? Hippocrates. Okay. All these are basic, but I am coming to the point. Who is the father of community medicine? John Snow. Who is the father of public health? Public health. That person's name is cholera. Cholera is a disease, no sir? How can it be a person name? So it's a disease, but it is such an important disease that it has completely it has revolutionized or it has drastically changed the course of infectious diseases. So cholera is a very important disease in human race, rapidly spreading and also so much of morbidity, so much of mortality. So everyone remember, so if we are speaking about community medicine or public health, you have to know about cholera. So you must have studied about cholera, no? Cholera, what are the symptoms of cholera? Just think. So your second year, no?
First year.
Second year?
First year.
Who are first year students? So first year students must have been freshly, you are out of the intermediate, no? MSET, you should have written MSET. And second year students are all the ragging students, No? Very good, second year students. So cholera, symptoms of cholera. Simple, just think. Diarrhea, diarrhea. Very good. Severe diarrhea. So due to the diarrhea, what happens? All the water gets lost. So what happens? Severe dehydration. So cholera main symptoms are severe, not normal diarrhea. Severe diarrhea. Severe diarrhea. Hence severe dehydration. Thirst obvious. Still. Try. See, all the interlinked, no. Diarrhea. So what is the organism causing the cholera?
Vibrio cholerae.
Very good. Claps. Our voice are also very high. So Vibrio cholera. So Vibrio cholera causes this cholera. Cholera will come step by step. Anything, no. In doctor or a nurse or a paramedical, everyone we should think like not like RMP doctor. We should think in a pathological way. So why the disease has occurred? Just RMP, what he does, when the patient comes fever, write the goli. Next, cold, write the goli. Whatever you have, write the goli. Just that is not the treatment, no. So a doctor, a nurse, what we should think is, why is this person having this cold? Why is this person having this diarrhea? So like we have to think in a symptom, not in a symptom, just not symptomatic treatment. We have to give. We have to take a larger picture. We need to have a larger differential diagnosis, and then we need to rule out. We need to think pathologically. So you all must have studied pathology, no? Or are you studying now? Pathology. No. You have the subject now, pathology. Which wave are we in now? Which wave of COVID you are going through? Third wave, Gaya, gone. Fourth wave, yeah. So this fourth wave, fifth wave, fourth. Any person got affected here from COVID? No one. Very good. So it must be your cleanliness or immunity power or very good. Whatever it may be. So no one got affected means it's very great. Again, tell me what are the symptoms of COVID-19? You all must have been experts in that, no? Headache, body pain. That is next thing. First, cough. Which cough? Dry cough. Dry cough. And cold. Breathlessness. So breathlessness. And also, still, in first wave we must have seen diarrhea. Diarrhea is also there. Still, important one. This is the important thing which doctors or nurses we should ask. What is that? Very good. Claps, claps. What is her name? Claps, claps. That's it. What's her name? Kiran. Let's all clap. Because that is the most important. Loss of smell, loss of taste, and also along with the chills, body pains, all these are there in COVID-19. So, severe symptoms. Severe symptoms. So, the saturation gets lowered. In which wave did we see that? In second wave we have seen so many people got the saturation got reduced. What happened? Oxygen shortage. Due to the oxygen shortage, so much of mortality. Not only morbidity. What is morbidity? What is mortality? Morbidity means? No. Morbidity means sickness or affected by the disease. What is mortality? All these terms are very important in this community medicine. So, second wave has higher mortality rate. So now, presently, morbidity, mortality, what is high? Mortality is very less, not severe. But it's not severe, no. We can take off the mask, we can do whatever we want. It's not like that, no. When we go into the public, we need to wear a mask. It's COVID is like, it will continue with us for coming 5 to 10 years, it will continue. Surely, it will get mutated. What are the variants until now did we see? What are the variants did we see until now? We must have Delta variant. Only these both students are answering, and back some people are answering. Boys, answer. Omicron. Very good. Omicron. Which is most powerful or which has caused most panic? Which one? Delta variant. Omicron. It's which wave? Third wave. In third wave, Omicron has occurred, but that Omicron did not cause so much of mortality. It caused morbidity, but less mortality. Next, in COVID, what we see? Just think. You told. So first and foremost, sore throat, cold, cough, loss of smell. All these we see in COVID. So cholera, we have seen few symptoms. COVID, we have seen symptoms. Next, what is the present trending disease? Trending disease now. Monkeypox. So, what is this monkeypox? It's a monkeypox. Is it a virus? Is it a bacteria? Is it a fungus? Is it a parasite? What is it? It's a virus. So, what are the symptoms? Just you need to know, because the trending diseases. We are doctors, our knowledge always, our doctors and nurses, our knowledge always should be replenished every day. We need to update ourselves. We can't read a book and throw it away, and bookish knowledge is not important. We need to have regular information. Regular recycling of data should happen. So what are the symptoms of monkeypox? Important symptoms?
Skin collecting. Skin collecting.
Very good. Excellent boys. You need these boys are excellent, really. They are answering very good. Skin rash. So rash around the genital area, and also face, and also neck, and also this rash is very important. And also cold cough may occur or might not occur, but the important thing is rash. Next, think. Still symptoms of COVID, monkeypox. Anyone have Google? Google. Backbenchers might have the phone, no? Google. Monkeypox, still symptoms. Rash is the important thing. Next. Fever, chills are okay. Another important pathognomic feature, that is characteristic. Important characteristic feature. What we have here? Huh? Here, axilla. Lymph nodes. So lymph nodes, enlarged lymph nodes along with rash, along with chills. So this monkeypox also, it has threatened the country once again. How many cases do we have now, monkeypox? So all over India we have less than 5 cases. But in AP, in our state also, few suspected cases have occurred. That's why we are doing all these kinds of studies. So, as doctors, as nurses, as medical, we are heroes. We are medical, we are heroes of the society. Because we always fight against the microorganisms, against the diseases. So, you are all take it as a privilege to enter into the medical field, because medical field is such a noble profession. So, in whatever kind of role we play, as a doctor, as a nurse, as a lab technician, as a whatever role we play, we are striving for a better mankind, better future. So, everyone think in such a orientation. So, we are having the Independence Day coming on 15th. Everyone gets the patriotism. Mera Bharat Mahan. They show their patriotism in social media. Social media. But rather, we can show. That's not Happy Father's Day, Happy Mother's Day, Happy Independence Day. Very good. Not only that day, we need to do it every day. We love our father or mother every day, no? No. Every day we love our parents. But that day, Happy Mother's Day. In the same way, we all love our country, no? We all love our country. So not only August 15th, every day we have to show patriotism. How do we show patriotism, sir? Respect. Answer. How do we show? Do our duties. So, if we perform our duties perfectly, we are striving, fighting for our nation. We are striving for the betterment of our nation. So, as medical professionals, all of us need to do our duties in a good way. So, train your mind or tune your mind in such a way that I have entered this medical field. There's no turning back. So, we should be service oriented. We should be service oriented, but not money minded. If we see money minded, what happens? We loot the patient. That's not right. How do we show our patriotism? How do we show our patriotism? Just Happy Independence Day, Mera Bharat Mahan. Only one Twitter or one status or one story, Instagram, Facebook. Okay, good. We can do it, but the most important thing is every day we need to have patriotism. No? So one thing is do our duty perfectly. Next, save the resources. Helping is good, but I am talking about saving the resources. See, saving the resources means God has given us such a beautiful nature. What are the what they say Panchabhuta? What means what? I don't Kannada. Panchabhuta. What are they? Sky and land. Ningi Nela. Sky. Land and water and air and fire. Five. So now one more Panchabhuta has come. Without that, people are unable to live. What is that? Very good. This is the Panchabhuta which has money and mobile. Because now without money, people are unable to live. Because that's not good. Money, you should not be money minded, and you should not be always addicted to this phone. No, people can live without air also maybe, without water also maybe. This phone is not there means can't live even 1 hour. No. What 1 hour, sir? Half an hour? No, sir. 10 minutes, sir. 10 minutes. So we need to get rid of the addiction of phone, because it kills our time, it kills our brain, it kills our energy, it kills our talents. So as medical professionals, we need to be alert. We need to be always the day you wear your apron, you are ready for a war against side bencher. No, war against the diseases. So as Indian citizens, we need to save our resources. Water, when we enter into the bath, no, put on the tap, run the water, so much water gets wasted. Not like that. Army people, they can bathe even with 2 mugs of water. Hearts are 2 mugs of water. 2 mugs enough to bathe. Sir. No. Army, sometimes they have such extreme conditions. So what I am telling is, since we are all medical professionals, we need to have awareness not only about diseases, about the resources. Save water. Save water. Next. Yeah. See, cholera, why has it occurred? Due to? Water in contamination. One more disease which is having due to the water contamination, food contamination, name it. What is that? T. Typhoid. Typhoid, what are the characteristic symptoms in typhoid? Important pathognomic sign in typhoid.
Onset fever.
That fever name is? What is step ladder pattern of fever? Important point. See, COVID, you have known few points. Cholera, you have known few points. Typhoid and monkeypox, you are knowing the pathognomic features. So that's what I am explaining to you. So, step ladder fever, 98, 99, 100, 102, 103, 104. High. Again gets low. Again high. Step by step. And also what happens in typhoid? Other important symptom? Abdominal pain. Leading to? Nausea leading to? Diarrhea. And the diarrhea also. What kind of diarrhea? Pea soup appearance. That is important MCQs. Right. Next. We are buying water. That previously there is no requirement of to buy water. Now also there is no requirement to buy air. Air is free. But in future we need to buy. Why I am saying all of this is preserve it. Boys, you like bikes, and also girls also like, no? You can ride, but old bike. Some uncles know, they go all the smoke gets emitted. The smoke contains nitric oxide and also sulfur dioxide. All these are gases affecting the ozone layer. Ozone layer, if it gets ruptured, what happens? UV rays directly gets on our skin. What did happen? What occurs next? Skin cancers. So UV radiations, UVA, UVB, UVC, all these kinds of rays are very, very harmful. These rays, they cause cancers. So now we shall keep this infectious disease aside and we shall come to non-infectious diseases. They are called non-communicable diseases. You have named few of them. The non-communicable diseases such as cancer. Cancer, it doesn't transfer to other person. What happens? It occurs within. So, what all kinds of cancers we have presently? What all kinds of cancers we are having presently? Any problem? What all kinds of cancers they are presently more common now? We come from top to bottom we'll go. Brain cancer, it's not so common, but brain cancer is very lethal. Next. Retinopapilloma, that's retinoblastoma. Okay, good. Next. Oral cancers we have, tongue cancer we have esophagus cancer, we have larynx cancer, and we have going down, we have stomach cancer, lung cancer, and also bronchogenic carcinoma. It's called bronchogenic carcinoma, and also next stomach carcinoma. Next, going to ileum, small intestine, large intestine, colorectal cancer. It's very common nowadays, and also rectal cancer, urinary bladder cancer. All these kinds of cancers are occurring due to skin cancers occurs due to radiation, but other cancers occur due to mutations. When the radiations, harmful radiations, when they get incident on our body, what happens is these harmful radiations, they cause genetic mutations. These genetic mutations, they cause the cell to grow higher rate, proliferative growth of the cells leads to cancer. Proliferative growth. What is cancer? Just you think, what is cancer? Cells? Yeah. No, not cell death. Rather than cell death, it's like increase in growth of cells. That's why we say tumor. Or tumor has occurred, cyst, like what is a mass is there, we tell no. Why is that mass? Because the more number of cells are growing, extra growth. We don't want that. That extra growth leads to tumors. So cancer and tumor, all these are same. So cancers are very common nowadays. What we need to do? We need to take care. Such as what kind of care? Getting moving away from X-rays. All your students, X-rays. When you're nearby X-ray, what you need to wear? Which gown? Lead. Which metal? Lead metal has to be used. That lead metal, it prevents the harmful radiations to be incident upon us directly. So all you medical professionals, you need to be very careful while going for an X-ray. Today we have learnt about infectious diseases and also non-infectious diseases. Non-infectious is only cancer we have discussed, but infectious diseases we have discussed so many. What are the infectious diseases we have discovered? We have studied cholera, COVID, monkeypox, and also typhoid. So all these diseases are infectious diseases. What are the non-infectious diseases? Cancer and also today we have not discussed. What is that? Heart diseases, cardiovascular diseases, and also what happens in the brain? Stroke. So cancer, heart diseases, and stroke. All these are non-communicable. Hypertension and all, diabetes also is it's a non-communicable disease. So today we end the class here. Just this is a small orientation class about public health, about the infectious diseases and about the non-infectious diseases. I thank all of you for your attentive hearing. Thank you.